Hi, I'm Linda Allen, and I'm completing my Master's in Public Health with a concentration of health promotion at Liberty University. My practicum was done at the Georgia Department of Public Health in Worksite Wellness. My research was in lactation. One of the issues I found in the program was that they needed to increase the proportion of breastfeeding mothers in the workplace, and by doing so, they need to raise the awareness amongst human resource department and the supervisors. Next page, introduction. This research is an examination of the activities to increase the number of milk-expressing mothers in the workplace. We're going to talk about the epidemiology of breastfeeding, the workplace environment, the biological effects of breastfeeding, as well as the sociological and the political effects of breastfeeding. The epidemiology of breastfeeding is the initiation of breastfeeding and the continuation of breastfeeding. Provisions of the mother's breast milk to infants within 1 hour of birth is referred to as the early initiation of breastfeeding and ensures that the infant receives the colostrum or first milk, which is rich in protective factors. The workplace environment contributes to the breastfeeding duration and success. Social support from coworkers and supervisors can be barriers or they can be facilitators of breastfeeding. Workplace stress makes it impossible to maintain adequate milk supply. Thus, a supportive employer provides flexible scheduling, flex time, job sharing, part-time employment, and breaks to pump. The biological effect of breastfeeding is associated between a history of breastfeeding and a reduction in the risk of being overweight or obese in adolescence and adulthood. There's also an association between breastfeeding and a reduction in the risk of maternal breast cancer and ovarian cancer. The sociological effects of breastfeeding involves the individuals who do not directly benefit from the accommodations of a lactation support room and may be more likely to report resentment as manifested in lower perceptions of fairness. And lastly, the political effect of breastfeeding is in Section 4207 of the Affordable Care Act, in which President Obama amended Section 7 of the Fair Labor Standards Act to include provisions for lactating mothers in the workplace and to include reasonable break time for nursing mothers. Next page. Methods. Activities included a survey of 8 multiple choice questions. Also, another activity was the lactation support policy brochure drop, where we dropped brochures on every desk at 2 Peachtree Street from floor 9 to 16. Also, there was the Lunch and Learn District presentation. This meeting was brought together by Worksite Wellness to discuss how other districts can set up and implement their own lactation support policy and lactation support room. Also involved was the Association of Maternal and Child Health Programs Workplace Breastfeeding Support Project. This was a mini grant for $15,000 that I had the privilege to help write, and it was going to be awarded to 4 different state agency teams, and they could take the money and take the grant and implement a breast policy or a motto or a lactation support room. Also, we had the breastfeeding and nutrition health fair. That was a really good turnout. There was about 100 people that showed up, both male and female. Many vendors from the state health benefit plan to discuss lactating mothers' insurance policies and the services they can receive from that. Also, we had maternal child health, WIC, Kaiser Permanente, and lots of goodies. And lastly, there's a 3-day policy training for Human Resource Department and supervisors in September, so they can learn about and be able to discuss with their employees the lactation support policy. Next page, results. 59% of the respondents plan to use the lactation room greater than 9 months, while 43.75% of the participants further indicated having access to the lactation room allowed them to continue to pump greater than 6 months from what had been originally planned. And this is really good news because this is meeting the national goal of pumping at least 6 to 12 months. 63.64% of the participants indicated needing 20 minutes to express their milk. By law, everybody is afforded two 15-minute breaks, and the lactating mother can use those breaks along with her lunch hour to express her milk. And if she needs more time, she's allowed that. 0% of the participants heard about the lactation support policy through their supervisor, while only 8.70% heard it from the Human Resource Department. Also, 0% of the participants heard about the lactation support policy through their supervisor, and 4.55% heard it through the Human Resource Department. Next page. Discussion. The survey clearly indicates the importance of having a lactation support policy and lactation room in the workplace. Although employers have a positive attitude toward breastfeeding mothers in the workplace, practices supporting breastfeeding isn't always the same. Implementing activities with a focus on breastfeeding promotion will begin to change the behavior of employees and increase the proportion of breastfeeding mothers in the workplace. Next slide. Limitations. During the 15-week practicum, balancing the preceptor's time and the student's availability did not always coincide. Another limitation that I was faced with was pertinent resources were not available in a timely manner, such as the lactation support policy brochure to implement a pre- and post-test survey. The study initially was proposed to be a mixed method study by having data from a focus group along with the quantitative data from the survey. Access to the study participants was another limitation, and this is at the discretion of the preceptor and or agency, and were not made available for research. And lastly, access to current data was not available. Next slide, implications. Building a business case for replacing the single breast pumps that the Department of Public Health has right now with double breast pumps in order to increase the amount of milk expressed during break times and decrease the time spent expressing. Another implication is implementing father groups is important for mothers to continue breastfeeding 6 to 12 months postpartum. And lastly, training of middle management on the federal and state law under the Affordable Care Act and Section 7 of the Fair Labor Standards Act. This is critical for state agencies to be in compliance with the law. Well, that concludes my video. A little choppy, but what do you expect? Anyways, thank you very much, Liberty University and all my professors. I had a really, really trying time, but thank you. Have a good day.